A very good morning, everybody. Today we will be continuing with the femur. In the last lecture, we have discussed the upper end of the femur. Now we will be discussing about the shaft and the lower end of femur. Now, as you know, this is the anatomical position of the femur with a convexity anteriorly. When we talk about the shaft is divided into three parts. We have upper one third, middle one third, and the lower one third of shaft. When you rotate the femur on the posterior surface, you can see this ridge is present. This ridge or the posterior border is known as the linea aspera. Okay, so in the center, in the middle one third, you can see that we have three borders. This is the anterior surface. We have three borders. We have a medial border, this one. We have a lateral border, and posteriorly we have this border that is thickened and is a ridge. This is known as the linea aspera. So we have a lateral border, a medial border, and a posterior border, and thus in the middle one third of the shaft we will have three surfaces. What are these surfaces? We have an anterior surface that lies between the lateral and the medial border. We have a medial surface that is lying between the linea aspera and the medial border, and we have a lateral surface that lies between the linea aspera and the lateral border. Talking about the upper one third of the femur, as you can see here, the upper one third of the femur has a medial border, a lateral border. When we move posteriorly, we see that this linea aspera diverges into two lines, one line and another line here. Okay, now the lateral line into which the linea aspera diverges, this is known as the gluteal tuberosity. This one is the gluteal tuberosity. The medial line is known as the spiral line, and this spiral line continues anteriorly with the intertrochanteric line of the femur. As you can see here, it becomes continuous with the intertrochanteric line of the femur. So again, we say that the femur is divided into, the shaft of the femur can be divided into middle one third, upper one third, and the lower one third. The middle one third has a medial border, a lateral border, and a posterior border. And then what are the surfaces you see in the middle part? We have an anterior surface, a medial surface, and a lateral surface. When we look at the upper part of the femur, upper part of the shaft of the femur, we see that we have a medial border, we have a lateral border, whereas when we see posteriorly, we see that this linea aspera is diverging into two lines. The lateral one is the gluteal tuberosity, whereas the medial one, this line that becomes continuous with the intertrochanteric line, is known as the spiral line, due to which the different surfaces that we see here are the anterior surface, the medial surface, the lateral surface, and a smaller triangle. So a smaller triangular posterior surface. Then talking about the lower one third of the shaft of femur. So the lower one third of the shaft of femur has a lateral border, a medial border. Posteriorly, you can see that this linea aspera again diverges into this line and this line. As you can see here, this is the medial part. So this line is known as the medial supracondylar line, and the lateral line is known as the lateral supracondylar line. What are the different surfaces in the lower part? We have an anterior surface, we have a medial surface, we have a lateral surface, and posteriorly we have this triangular surface. This triangular surface is known as the lower triangular or the popliteal surface. So this is about the different borders and the different surfaces. So in the upper part, we have 4 borders. What are these? We have the medial border, the lateral border, the gluteal tuberosity, and the spiral line. In the middle part, we have the linea aspera. Whole of this thickness is the linea aspera. We have in the lower part, we have lateral border, medial border, we have a medial supracondylar line, and we have a lateral supracondylar line. Talking about the attachments of femur, which is very important. Now, talking about the attachments of the shaft of femur. The attachments on the upper end of the femur have been discussed in the previous class. Now, to remember it, you have to remember that on the anterior aspect and on the lateral surface of the shaft, you have attachment of the vastus intermedius muscle. So, the anterior surface and the lateral surface gives attachment to the vastus intermedius muscle. Then, as you have seen in the last lecture, that this intertrochanteric line, the lower part of this intertrochanteric line was giving attachment to the vastus medialis, whereas the upper part of this line was giving attachment to the vastus lateralis. So, vastus medialis will be attached on the lower part of this intertrochanteric line. As I've told you that this intertrochanteric line becomes continuous posteriorly with this line, that is the spiral line. Therefore, vastus medialis will be attached spiral line पे. स्पायरल लाइन के बाद नीचे ये जो लीनिया एस्प्रा है, इसके 2 लिप्स होते हैं, एक मीडियल लिप होता है और एक लेटरल लिप होता है. सो ऑन द मीडियल लिप ऑफ द लीनिया एस्प्रा, देन लोअर डाउन इट बिकम्स कंटिन्यूअस विद the supracondylar line, right? So the vastus medialis is attached anteriorly to the intertrochanteric line, then the spiral line, then the medial lip of the linea aspera, and then the upper part of the medial supracondylar line. Okay. Laterally, you had the vastus lateralis. The vastus lateralis is attached to the upper part of this intertrochanteric line. So it will be attached on the lower part of this upper part of this intertrochanteric line. Then it is attached on the lateral surface of the gluteal tuberosity, and then it becomes continuous. This is attached on the gluteal tuberosity, on the lateral lip of this gluteal tuberosity. This elevation is the gluteal tuberosity, right? So the lateral lip of the gluteal tuberosity, then the lateral lip of the linea aspera. It is attached to the lateral lip of the linea aspera. Okay, so what did we see? We saw that here there is attachment of the vastus medialis on the spiral line, on the medial lip, up to the medial supracondylar line, whereas laterally you have attachment of the vastus lateralis on the inferior surface of the gluteal tuberosity, on the inferior surface of the greater trochanter, the lateral surface of the gluteal tuberosity, and the lateral lip of the linea aspera, and the lateral supracondylar line. Okay, then we have on the gluteal tuberosity. On this gluteal tuberosity, you have insertion of an important muscle, that is the gluteus maximus muscle. So here we have the gluteus maximus muscle. Okay, on the gluteal tuberosity, we have the gluteus maximus muscle, the insertion of gluteus maximus. Then on just below the gluteal tuberosity, the lateral lip of the linea aspera gives attachment to the short head of the biceps femoris muscle. Short head of biceps femoris muscle. Then there is a line that extends from the lesser trochanter till the spiral line. This gives insertion to the pectineus muscle. The pectineus muscle is inserted here. After that, we have the pectineus muscle, we have adductor magnus muscle. The adductor magnus muscle is attached on the medial side of the gluteal tuberosity, on the linea aspera. It extends downwards on the medial supracondylar line, and then lower down it is attached to the adductor tubercle, which I will be discussing later. Then the area between the adductor magnus and the pectineus, Upper part we have the adductor brevis, and lower part we have the adductor longus muscle. Talking about the lower end of femur, the lower end of femur presents two condyles. We have a medial condyle and we have a lateral condyle. The two condyles are separated from each other posteriorly by this intercondylar notch, whereas anteriorly these are continuous with each other through this patellar articulating surface. This one is the patellar articulating surface. Okay, now when we talk about this condyle, that is the medial condyle, first we'll look at the medial condyle. So the medial condyle, this is the medial side, okay? Now, the medial condyle has 5 surfaces. It has an anterior surface, a medial surface, a lateral surface, inferior surface, and a posterior surface. So what are the different surfaces? If you hold the bone like this, okay? So we have an anterior surface, a medial surface, a lateral surface, posterior surface, and inferior surface. On the medial condyle, we have a prominent part, this prominent projection, that is known as the medial epicondyle. The medial epicondyle gives attachment to the medial collateral ligament of the knee joint. Above and behind the medial epicondyle, we have the adductor tubercle. The adductor tubercle here gives attachment. This is the medial epicondyle. Here we have the adductor tubercle. The adductor tubercle gives attachment to the ischial fibers of the adductor magnus muscle. Okay, now this was the medial surface. The lateral surface of the medial epicondyle forms the medial margin of the intercondylar notch. The anterior surface is the patellar surface, articulates with the patella. The inferior surface here, it articulates with the tibia, whereas the posterior surface articulates with the tibia during full flexion of the knee joint. Okay. The lateral condyle. This is the lateral condyle. The lateral condyle also has 5 surfaces: anterior surface, lateral surface, medial surface, posterior surface, and an inferior surface. The anterior surface is known as the patellar surface. The lateral surface, as you can see here, the lateral surface presents a projection. This projection is known as the lateral epicondyle. The lateral epicondyle here is for the attachment of the fibular collateral ligament of the knee joint. There is a smooth impression behind this. This gives origin to the lateral head of the gastrocnemius here. So we have lateral head of the gastrocnemius that originates from here. Okay. Then this groove below and behind the lateral epicondyle provides attachment to the popliteus muscle. Okay, so we had an anterior surface, that is a patellar surface. We had a lateral surface. The lateral surface had a projection that was known as a lateral epicondyle. Behind the lateral epicondyle, we had a smooth area for the lateral head of the gastrocnemius. The lateral epicondyle was giving attachment to the fibular collateral ligament. Below it, we had a groove, and this groove is for the popliteus muscle. Then, similarly, we have an inferior surface, we have a posterior surface. Inferior surface articulates with the tibia, the posterior surface articulates with the tibia in full flexion. Then we have a medial surface here. The medial surface forms a part of the intercondylar notch. The intercondylar notch is bounded posteriorly by this line that is known as the intercondylar line. And intercondylar line. Okay. Now, it is intracapsular but extra synovial. यहाँ पे जो चीज़ याद रखनी है वो ये रखनी है कि एंटीरियर क्रूशिएट लिगामेंट जो है वो मीडियल सरफेस ऑफ लेटरल कॉन्डाइल पे लगता है ना. ये लेटरल कॉन्डाइल है, लेटरल कॉन्डाइल की मीडियल सरफेस ये है और मीडियल कॉन्डाइल की लेटरल सरफेस ये है. सो एंटीरियर और पोस्टीरियर क्रूशिएट लिगामेंट जो होंगे वो अंदर की तरफ से लगते हैं. जो हमारा एंटीरियर क्रूशिएट लिगामेंट होता है वो अटैच हो जाता है पोस्टीरियर पार्ट ऑफ मीडियल सरफेस ऑफ लेटरल कॉन्डाइल पे, और हमारा जो पोस्टीरियर क्रूशिएट लिगामेंट होता है वो एंटीरियर पार्ट पे लगता है, एंटीरियर पार्ट ऑफ द lateral surface of the medial epicondyle पे. ठीक है. Then they have the capsular ligament which is attached to the intercondylar line here. Then the patellar surface here. The patellar surface covers the anterior surface of the condyle. As you can see here, it extends to a higher level on the lateral epicondyle. On the lateral condyle. दो surfaces के बीच में we have a vertical groove here. Then we have two grooves here as well. ये groove और ये groove that separates these patellar surfaces from the tibial surfaces. When we talk about the tibial articular surfaces, they cover the inferior and the posterior surface of the condyles. These articulate with the condyles of tibia, and these are separated from each other by the intercondylar fossa. Now, talking about the attachment on the lower end, the attachment of the capsule on the upper end has been discussed. The attachment on the lower end of the capsule is that posteriorly it is attached to this intercondylar line, whereas laterally and medially it is attached about 1 centimeters above the adductor articular margins of the joint, above the articular margins of the joint. And anteriorly, when we see, the capsule is deficit. Why? Because it communicates, the joint cavity communicates with a bursa that is present here, that is known as a suprapatellar bursa. Talking about the ossification of this bone, one center of ossification appears for the shaft at 8 weeks of intrauterine life. Secondary centers 3 ऊपर नीचे 1, ऊपर 3 हेड के लिए 1 फर्स्ट ईयर में, ग्रेटर ट्रोकेंटर के लिए 3 साल में और लेसर ट्रोकेंटर के लिए 13 ईयर्स में. ये एपिफाइसिस सारे फ्यूज़ करते हैं 18 ईयर पे. लोअर एंड पे हमारा आता है एपिफाइसिस जो कि 9 मंथ्स ऑफ इंट्रायूट्राइन लाइफ पे आता है और फ्यूज़ करता है हमारा 20 ईयर्स पे. This finishes your femur.